And this afternoon, Joy News is learning that the Ghana Health Service and officials are racing against time to prevent what could potentially be the spread of the monkeypox disease after 5 cases of the rare infection were confirmed in the country. These were from 12 samples collected across the country. Now, though the first cluster of the latest cases of monkeypox were detected in the United Kingdom, the disease is fast spreading in Nigeria, Cameroon, and other West African countries. This afternoon as well, Ghana has become the latest to record the case in the West African area, Eastern and Greater Accra regions as well, we're understanding some of these cases are coming from. Manuel Kranting is a member of the health desk and also attended that news conference. He is joining me via Zoom to give us a breakdown of what it is that we're learning of this virus. Manuel, thanks for your time. So quite a scary situation, but I'm sure that the health officials are explaining what they're doing to put everything under control. But first of all, give us details of where these cases are actually coming from.
Also, Blessed, these are 5 cases which were confirmed from 12 samples collected from various parts of the country. Indeed, we're told that a total of 3 regions currently have confirmed cases of monkeypox here in Ghana. Particularly, you'd have the Greater Accra region, you have also the Western region, and the Eastern region. All of these regions currently have confirmed cases of monkeypox, and so that's by way of details and of course the distribution of the cases that we have in the country. We can just briefly listen to Dr. Patrick Umabwaji as he gave details of this particular outbreak at that news conference.
In 3 regions, Eastern, Western, and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded in a Ghanaian who traveled to the United States from Ghana. So I picked it from here. It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how it went. And then, of course, then the rash and the blisters will appear. That's how monkeypox is. That doesn't mean that every rash is monkeypox. There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so especially the West African one is mild to moderate. So we only treat at the symptoms. If you have fever, we give you something to bring your temperature down. Body aches, we give you some painkillers to bring it down. You must make sure that the skin lesions are kept clean. You boost.
Okay, then. So let's give you a breakdown, first of all, of the cases we have, where we're having them come from, and what it is that you need to know about this. It's on your screens right now, giving you an overview of what we're talking about. So here's the case of monkeypox, and we know that is a zoonotic disease caused by monkeypox virus, and beyond that, we also do know that it's actually endemic as we speak in neighboring countries such as Nigeria and also some other African countries, including Cameroon. Now, it is transmitted from an infected animal, we have squirrels, rats, and monkeys as well, or from infected humans. So it's transmissible. And then we also do know that human-to-human transmissions can occur through a skin-to-skin contact, if you have a face-to-face contact as well, and a mouth-to-skin contact, that can actually be a ground by which you could be attracting the virus. But then it can also be spread through touching, towels, clothing, or other objects used by an infected person. So if you're wondering what the virus is about, that's an overview for you. But in terms of the signs and symptoms, we have fever, you have the swollen lymph, and also headaches, muscle and back aches as well. General body weakness is part of the symptoms that we're getting from the health officials on this matter. And then you could have some rashes with blisters on your face, your hands, and some other parts of your body, including your genitals as well. So these are some of the features, signs and symptoms of the viruses we're talking about. But for now, we do know that a total of some 12 suspected cases of monkeypox have been investigated since the 24th of May 2022. However, 5 is what is confirmed in our country today. Regions is what the focus is telling us, Eastern, Western, and then Greater Accra. These are some of the early detection points. We are unable to tell at this moment if there will be any more cases in the coming days, but we're certain that there are no deaths. There's only one case which has been confirmed in terms of a Ghanaian who traveled to the United States of America. So that's the point from which we're having the infection. And now, as we speak, there are over 1,000 confirmed cases of monkeypox cases in 29 countries. So that's the overview of the cases that we're dealing with here in the country in terms of the monkeypox virus. I'm sure that many of you have questions and are wondering what exactly this virus entails. There's a need for us to hear from the experts and also try as much as possible to hear from them, know more about the virus and what it is you can do out there just to be safe. So we'll be bringing all of that to you. We'll be speaking shortly to Dr. Thomas Anaba, who will be joining us via Zoom. He's with the Africa Center for Health Policy Research and Analysis. We'll also be hearing from the Ghana Health Service as they provide us with some perspective on the matter. But here's a pictorial view in terms of the global map. As you see it here, Europe appears to be the hotspot in terms of the early detection that we're talking about. So you have many of the cases spread across Europe, and then parts of North America, and we have South America also having some dotted cases around there. But here we are in Africa, and it appears that apart from the northern parts, Ghana appears to be some of the early countries in the West African sub-region recording cases. Then we have some dotted cases as well in Asia, and Australia is also having its fair share of the situation. But for those of you who are wondering where exactly the hotspot is, it's in Europe, but it's surprising that the virus was transmitted this time around in our case from from America itself. We're not sure if it's from the northern part or the central parts of America, and that's where the person traveled to, as we're hearing from the Ghana Health Service officials, traveling back into the country. So it appears that it's a case of importation. That's what we are learning of, and that's the indication we're getting from the health officials on this matter. And also, we are hearing that initially, as of May 2022, some 12 cases were investigated. And then, obviously, what we're dealing with now is that 5 have been confirmed. We'll try as much as possible to get some of the health experts talk to us shortly. We'll delve into the matters in terms of the cases that we're hearing of, what you need to know and how you need to go about it. We'll also be telling you about the official indications we're getting from the Ghana Health Service on this matter. It's all coming up here on The Pulse. Please stay with us. Let's now bring in Dr. Oliver Comey. He's with the Infectious Disease Surveillance Unit of the Ghana Health Service. Earlier, we're telling you about the discovery of the monkeypox virus. It's in Ghana, 5 cases confirmed. Dr. Thomas Anaba as well is with the executive. He's with the Africa Center for Health Policy Research and Analysis. He's the executive director. Thank you for joining us. So, Doc, let's start off with you. The Ghana Health Service is giving us a clear indication on that. Dr. Anaba, before I come to you, let's hear from the Health Service as to, first of all, whether or not we should be worried, especially as we seem to be hitting some viral infections alongside with neighboring countries such as Nigeria. What should we be expecting from your outfit as the Ghana Health Service?
So, thank you very much and good afternoon. Sorry, I'm not able to share my video, so I hope the voice is okay.
That's perfect.
Okay, so today we all heard the news about 5 cases of monkeypox having been recorded in Ghana. The question you asked is whether we should be worried, and the answer is we do not have to be worried, because Ghana is one of the 10 endemic countries where monkeypox already exists. But Ghana has currently been identified only in animals, so we are expecting it. We are seeing it for the first time, maybe in humans. But be that as it may, across the West African sub-region, monkeypox is an endemic disease. So we do not have to be worried about monkeypox. The reason why a lot of noise is being made about monkeypox because we are finding monkeypox in non-endemic countries. If you should find monkeypox one case in a non-endemic country, they will be worried. But to find monkeypox in an endemic country, we do not have to be worried.
But what's surprising is the point of importation. It appears that someone is bringing this in from the United States of America, as we're hearing from the health service. What's accounting for some of these transfers, if I could use that word loosely?
If you say that you are hearing that, I don't think we are telling you that it was imported into the country, because for us it's an endemic disease. So then let's say maybe you are seeing it in a person who is not living in an endemic area. So to say that it was imported, I'm sorry, I cannot speak to that. Now, when it comes to monkeypox, transmission generally is direct contact with either the fluid from the rash or from the beddings or utensils that somebody has used. We might say that monkeypox is common, and maybe if one person is in the family gets monkeypox, you may tend to have a cluster in the family getting monkeypox. It's mainly by direct contact.
Okay, these are some of the signs and forms of transfer. But in terms of the symptoms, what are the general features for you to see and be able to tell that this is someone who is suffering from one of the infections?
Okay, so unless the person complains about having the rash, together with you, the doctor, finding out that the person has swollen lymph nodes. When I say lymph nodes, they are the lymph nodes respond to infection. So sometimes people call them the glands. You may have them around your ear. Typically, they may be swollen either in the armpits or around the groin. If you have a fever, if you have a rash, and you have swollen lymph nodes, then you can think about monkeypox. Monkeypox resembles either chickenpox or measles. To be able to differentiate between the three of them, monkeypox usually will go with swollen lymph nodes. If the person hasn't got swollen lymph nodes, it will be quite difficult for you to distinguish that from either measles or chickenpox.
Anyway, and the concerns about vaccination. It appears this is not a new virus, so it's fair to suggest that you have vaccination under control, right?
So let's say that monkeypox falls within the same family as smallpox. And we must say that it's been documented that if you give the smallpox vaccine, it can take care of the monkeypox. Having said that, they've also come up with two new vaccines, but that is not widely used as of now.
I'll be coming to Dr. Thomas Anaba shortly so we can get some more perspectives on this. But as we wrap up, the concern about the outlook, we could bring back the map for you just basically so we can see the level of spread. You see parts of North America, South America, and then the concentration is in Europe. Are we heading towards another situation where we could have, I'm afraid to use the word, a pandemic? Is that far-fetched? Dr. Oliver.
Hello?
Yes, Dr. Oliver, I'm asking if it's far-fetched to say we're moving towards...
No, let me share. Okay, so that is the picture, but let me also share with you cases of monkeypox in endemic countries between December 2021 to May 1st. The key countries here are Cameroon, Central African Republic, DRC, and Nigeria. So for Cameroon, they've had 25 cases from last December. Central African Republic has recorded 6 cases. DRC has recorded 1,238 cases. And Nigeria next door has reported 46 cases. Those other countries, the non-endemic countries, are recording 2 cases, 4 cases, 5 cases. The key thing I want to put across is there's no need for us to go into a panic drive just because some people are recording 4 or 5 cases. These are an endemic diseases, and in Africa, the numbers I gave you, we recorded close to over 1,400 cases already. But we haven't made so much noise because we are able to manage it.
I was about coming to that, and that's why perhaps the public is anxious now, wondering what to be wary of, how to step out, and what to be, on the lookout for. What's the general advisory on that?
Okay, so that if somebody has monkeypox, the best way of protecting yourself from getting monkeypox, we said it is by direct contact. So you need to protect your hands. So you need to wash your hands well. You need to make sure that you wear gloves if you are managing somebody with monkeypox. You need to make sure that the one who has monkeypox, is wearing protective clothing, let's say long sleeves, or let's say trousers, so that you do not come into contact with the crust or the rashes. For the person, you also need to make sure the person wears a mask. And if you are the one who is managing the patient, also wear a mask. All I'm trying to say, all the things we've been doing, wash your hands, wear gloves, use your nose mask, it's the same thing you do for any virus. So I will say that we should just need to, the kind of things we've been doing, we just need to make sure that we are following the same things.
All right then, Dr. Oliver, thank you for joining us. Let's hear from Dr. Thomas Anaba, who's joining us via Zoom. Dr. Thomas Anaba, if you're with us, so you at the Africa Center for Health Policy Research and Analysis, obviously we're told that this is an endemic region. Should that give us a great assurance that the health officials are equipped enough, have enough capacity to contain the situation? Yes, Dr. Anaba, I was asking if, we're being told now, just a while ago by Dr. Oliver, that this is an endemic region, so it appears we're not new necessarily to this virus. Does that mean that we have enough capacity to contain the cases? Kindly unmute for me so I can hear the point you're making, Dr. Anaba.
Worried at all about this? Thank you. I'm saying I can't but agree with Dr. Oliver Komi for his excellent presentation, and then trying to tell Ghanaians to feel free and not to be alarmed about this disease, simply because it is just like we have malaria in Ghana. If the US is reporting malaria, Ghana shouldn't be bothered about malaria, because we already have it here with treatment, and at least we know how to manage it well. So this monkeypox is something that has already been living with us. Just that we don't see it in those numbers within Ghana, but other countries are suffering it. Just like he has mentioned, he's given a total of 1,000-something cases in West Africa recently. And that the management is virtually the same way that like we were used to manage COVID-19. The prevention is the same way we used to do for COVID-19. So now I know we are all used to it. What we just have to do is that when we see somebody with those boils on the body, let me call it boils for the ordinary person on the body, try to let him go to see a doctor for them to make sure they differentiate it from the other forms of diseases that are similar. And if it happens that they diagnose him of monkeypox, then they'll give him all the necessary support and preventive measures so that he doesn't spread it in the community. But Ghanaians should be calm and shouldn't be rushing to do anything. Monkeypox has been with us for a long time, and it won't do any serious harm to anybody if he contracts it.
If you're saying that the protocols are almost the same as the COVID-19 pandemic, is this really the time to reopen the detention facilities to at least accommodate persons who may be detected of having the infection?
We don't need to. Most of the symptoms are not that very bad. You don't need a doctor by you all the time to manage you. You can easily be managed even from your home. So this doesn't really need any special detention center for it to be opened. What we just need to do is to make sure we advise anybody who is positive, advise the family members on how to behave with him. And just after 2 weeks, he'll be fine and everybody will be fine. The only serious thing that may happen to him is that he may have some scars that may damage his aesthetic, and maybe he has to be wearing long sleeves and long trousers all the time, anytime he's going out, to cover all those scars. But monkeypox in general is benign. Yeah.
And for policy
measures, government should educate the public like you are doing right now. Get more media houses to educate the public about its presence. Get the doctors and nurses recapitalize on it, and then at least have suspicion anytime they find anybody those boils on the initiation, and if it is monkeypox, they treat it. I think these are some of the things that we should do.
In terms of stigma, is that likely to be a challenge for persons who may be treated and discharged?
No. I don't think there will be, because people get chickenpox in Ghana and they have those scars in their body. So it's just similar to chickenpox. It's chickenpox, anything like a stigma, unless we start preaching very bad news about it to make people fear it. But there shouldn't be any stigma to anybody who recovers from monkeypox.
How about the issue of vaccination?
How for the vaccine, as Dr. already told you, the vaccine for the chicken able to manage it. I don't think that we have the two new vaccines that they have in other countries that are not endemic. So whatever we want to do now is to make sure we educate the people and don't get to a stage that we'll be having what we call need to give vaccine to everybody. That is going to be a cost, simply because its effect on the human body is not so dangerous, it's not so lethal that we should spend a whole lot of money that we even need to buy coronavirus vaccine we are not getting. We should just educate people and they will be able to minimize the spread and down the rate. Okay, then, Dr. Anaba, as we wrap up, what's your message to the public in these times as we're learning of 5 new infections? Thank you. I'm just repeating what Doctor said. Everybody should be looking out for any unusual boils on the skin, so that if you see it, go to doctors for them to determine whether it is monkeypox or not. If you go to hotels, hotel owners and hospital owners should make sure linens are washed properly, and we don't use the same linen for people who are suspected to have monkeypox. Disinfectant, spray on their seats and then the rest, and clean them well. If they suspect somebody with boils have come into the car and travel into the car, so that it limits the spread in case the person was positive. That is what I would advise. All right then. I guess it's time now to hold on with this conversation. We'll get back to it. But